Hey guys, welcome back to Nora's Table. We are sitting here with Dr. Jordan Soper, who is a psychologist and sex therapist. Jordan, introduce yourself. Tell us a little bit about yourself.
Oh, this is a broad question, but I will do my best. So I am a board certified cognitive and behavioral psychologist here in Nevada, as well as up in Washington State, as well as an ASEX certified sex therapist. And what all of those things mean is I really emphasize evidence-based treatments with adults who deal with anxiety disorders, trauma disorders, and sexual health and functioning disorders, which pretty much accounts for 90% of our population for the most part. So
You were also telling me you did a lot of work with the VA. Tell us about that.
So I did the majority of my training in the Veterans Health Administration. So I was working with military members and veterans with a focus on trauma. So my background is primarily in the trauma land. So individuals who've had military sexual assault, combat trauma, as well as a lot of childhood related trauma disorders that maybe have been impacting them throughout their lifetime as well. And then I work a lot with first responders now, so police officers, firefighters, EMTs, and I work a lot with the BDSM and kink community as well. It's kind of an area that I feel very passionate about, as well as the geek community, because those are my people.
Why are they your people?
I was raised in a world that was very encouraging of sci-fi. One of my nicknames actually comes from Star Trek. So my family raised me in a land of geekdom. So that is something that is very important to me. Doctor Who, Star Trek, Star Wars, Harry Potter, pretty much the majority of those worlds.
Nice. So we kind of wanted to do an episode with you today talking about how to have healthy sexual relationships post-trauma. So those that have been sexually assaulted, raped, any domestic issues, that kind of stuff. Once you've had that layer of intimacy and security kind of stripped away from sex, how do you then get back into that mindset to move forward?
Mm-hmm. And it's a very imperative question. It's also a very broad question. The majority of individuals are going to experience at least one traumatic event in their lifetime. And unfortunately, the traumatic experience that is most likely to lead to later PTSD is interpersonal violence, which is sexual assault, rape, or domestic violence is in there as well, so like physical violence, but usually there is a bit of an overlap between domestic violence, physical violence, and sexual violence in relationships. So it's a matter of looking at where that negatively impacts a person's functioning, particularly within sexual functioning. And I'm a very big proponent of sexual assault has nothing to do with sex. They are very different entities. But in sexual assault, the weapon used is sexual functioning or is sex. So it makes sense that your brain is going to translate that paired association between sexual assault and a trauma and anxiety in a non-trauma situation, like with a consensual sexual partner. And that's usually where quite a bit of the overlap comes into play, and why a lot of individuals who have a sexual assault history do have ongoing sexual difficulties in their relationships with both themselves and their partners too.
So if sexual assault is not really about sex, what is it about? What are they looking for?
It is all power and control. For individuals who engage in sexual perpetration, so the individuals who actually engage in the pattern of behavior, it is dehumanizing or removal of the power of their victim. I hate to use the term victim, but I call them survivors, but in this context, it's victim, where they are trying to remove their power, and the way to do that, the weapon used, is the sexual violence.
Earlier, we were talking about how you do a lot of work with the VA and with men. We were talking about how men sometimes will have a harder time coming forward and reporting sexual assault. Why is that?
A number of reasons, but particularly here in the U.S., we live in a culture that not only is very puritanical, so we don't really talk about sex in general, much less sexual issues or sexual assault, but particularly with men and boys who have experienced sexual assault, there is a lot of shame associated with it. There's also a negative perception or a misperception that men cannot be sexually assaulted by women, or the idea if they are sexually assaulted, that must mean they're gay, and a lot of other cultural variables that decrease the likelihood that they're going to be listened to. Not to mention, when we are talking about sexual assault, we are talking about power and control, and there's a lot of emphasis for men in our culture to be strong and manly, and if they're not, well, then they must deserve it, or maybe that's why. So the number of individuals I work with who were in the VA, but also I do a lot of my primary practice right now is in private practice land. The men that I work with in that environment report feeling as if they are going to be more negatively judged by their peers, by their female partner. So it really decreases the likelihood they're going to come out and share their experience. And certain movements have really shamed a lot of men for coming out and saying, well, this is not your place, this is not your platform, where I'm a very big advocate of sexual assault survivors are equal. Like, there is no gender variance, because that's also very shaming for our trans population as well, where you have someone who's a trans man or a trans woman who's experienced sexual assault.
That's got to be very confusing for men if sexual assault is mostly about control and power to be assaulted by a woman, whereas in society, men are supposed to be more in control than a woman, so to be assaulted or traumatized by somebody that society considers inferior is probably an extra layer of complexity.
And it's also when you get into gender variance or gender differences amongst the gender of the perpetrator versus the gender of the victim, you get into a lot of cultural overlap too, in the way that we socialize boys to be like, oh, she's older, way to go, bro, like the hot teacher thing,
cougar and
the cougar, and I'm like,
yeah,
she's way older than you. Like,
yeah.
I'm of the age that I remember the case of the female teacher who sexually assaulted, I'm going to use the term, she sexually assaulted her 15-year-old student. She got pregnant by him, served her jail sentence, and then they got married, had another child. And people are like, well, that's a hot teacher. Like, wouldn't you, bro, want to have sex with you? Way to go, dude. I'm like, oh my God.
Yeah, she's still a predator. And as a mother of boys, let me fucking catch a woman making eyes at my son. I don't care. Until he's 18, hands off. I don't care who you are.
Well, we even see that in, like, celebrities and things. Like, there was this count. Like, I remember when Britney Spears and Christina Aguilera were, like, turning 18. People were like, oh, yeah, they're, like, countdown to the 18. I'm like, we still do that to boys, but somehow it's not as bad. These are much bigger concerns that we're looking at, like bigger socio-cultural issues, and we have talked a lot about the role of power and control dynamics when it comes to sexual violence. We do see a higher rate amongst individuals who identify as women. The concern is we're dealing with what are called reporting issues. So the majority of people who are survivors of sexual violence, the violence has been perpetrated by someone they know, primarily a family member. Date rape or acquaintance rape is very common in assault in those moments. So we see it a little bit. We have more people reporting it who identify as female, but because of the cultural issues that come with our boys and our men, they are less likely to report it. So our numbers are actually probably very low as far as what the actual rate is, because we know it's 1 in 6 men will identify as surviving a sexual assault versus 1 in 3 women. In all transparency in the work that I've done, I think it's honestly a lot more equal.
How common is it for men to be date raped?
It's a little less common. We do see it a little bit higher in the LGBTQ plus population, but not much higher in those moments. I see it in positions of power dynamics. So I saw it a lot in the military population. We see it in fraternities a little bit. Anytime you get into where there is an authority figure in a position of power versus someone who is like a kind of lower entity. We see it a lot in the church, and that's going to piss a lot of people off. If you've not seen the movie Spotlight, please go watch it and be prepared to get very angry. But the reason I do bring that up is we see sexual assault in positions where someone is in a position of power and one person is a subordinate. That is going to be one of the most risky situations. So we see that's why we see it so much in family members as well, but the clergy, that's a really big issue internationally too.
So if you have a client that comes in that identifies as male, they've been sexually assaulted, where do you start as far as therapy-wise? Where do you start?
Well, we always start with informed consent, and that's with any patient. Big nerd on informed consent. We're walking a patient through the nitty-gritties of what you're going to be doing, any limitations to confidentiality, really diving into that. But I like to start with what I call a semi-structured interview, so looking at the ways in which they identify the impact of their current symptoms, as well as historical information on their current level of functioning. Does the person have erectile concerns? Do they have any out-of-control sexual behaviors? How's their anxiety? How's their sleep? How's their mood? And really getting a good baseline. For individuals who've experienced sexual assault, particularly for men who've experienced sexual assault, I'll typically, and this is just in my practice, I'll see a little bit of out of control sexual behavior or a lot of shame related to solo sex behaviors. So higher levels of maladaptive pornography use, higher levels of erectile dysfunction. We'll see a little bit more on that side as well. But again, we're trying to do more and more research on this topic, but due to limitations in the field and limitations in reporting, we still don't know everything about it. So I typically like to take a very person-centered cognitive behavioral approach to identify specific concerns that the patient has and looking at specific patterns over their lifetime.
Are there differences in the symptoms of post-sexual trauma for men versus women?
Great question. Not really. They're pretty universal. I like to say trauma doesn't discriminate. It doesn't really give a shit who you are or any variable. There are no racial, gender, socioeconomic, so monetary differences, trauma doesn't give a shit.
Does the aftermath look the same for both genders as far as like the excessive use of pornography, things like that, maybe withdrawal?
A little bit. We'll tend to see in those areas, we'll see some differences, but not nearly enough that we'll be able to say, yeah, this is definitely a female identified person thing, or this is a male identified person thing. We don't have enough information to say it's one or the other for the most part.
Lauren, I saw you jotting down over there. Do you have a question?
Well, I'm just taking this all in. Like, this is all super great. You're doing great with all of your questions. Mm-hmm. I guess one thing that kind of popped into my mind as we were talking is society. So our society is very over-sexualized. It's in the media, it's in magazines, it's shoved in your face since you're super young. But yet there's this contradiction of not talking about sex and not talking about it in a healthy way. Mm-hmm. So how do you want to maybe give listeners suggestions of like how can we have healthy conversations about sex, maybe with children or within ourselves, and then how has society influenced our views on just sex overall?
Mm-hmm. It's a great question, and it's one that we probably will have like 9 podcasts on in all transparency, just for the nature of the beast. When we look at media and advertising, the idea of like sex sells, the reason sex sells is because we don't talk about sex. This is where, if you've ever read some of the early interviews by Hugh Hefner and why Playboy got started, it was very much oriented as an example of let's talk about this topic, and the recognition from a marketing standpoint, if it works, fucking go. So there is a lot of component there. I think the reason sex sells and sexualization in our culture is because it's taboo and we don't talk about it. So it makes it more of an anomaly, and we can be like, this is fascinating. And then in our general culture, though, we don't talk about sex. It's very shamed. Like certain cultures are very anti-sex, unless anything above and beyond reproduction, then we don't talk about it. So it really proves an opportunity for misinformation to come in or just unhelpful patterns. And that's when we look at the role of sexual assault in this. One of the reasons sexual assault happens at such a rate that it does is because we're not talking about it. We're not teaching children to use medical terms for their own bodies. We're not teaching parents to look for signs of sexual assault, because a lot of parents are like, that can't happen to my kid. No, it can happen to anyone's kid. And looking at the factors associated with it that are more likely to happen. So we spend a lot of time in our culture talking about stranger danger or stranger rape, which accounts for less than 5% of all sexual assaults. We don't talk about marital rape. We don't talk about sexual assault in the clergy. We don't talk about it within family members, extended family members, babysitters. One of my favorite bands ever is Slipknot, and Corey Taylor is a male sexual assault survivor, and he talks a lot about the experiences that he's had. It was a female babysitter and her boyfriend that assaulted him for the first time. And he speaks very eloquently about the way that that impacted him and changed his sexual patterns of behavior. And being able to speak out more about these issues really highlights that sexual assault is different than sex, because people will often equate it together, and they are very, very different.
I want to loop back around to us having age-appropriate conversations with kids and how important it is to let your kids know the proper anatomical terms for their bodies. Why is that so important?
It's so important. There's lots of reasons. So comprehensive sex education, we talk about that in the school system as well as within the home. It's really talking about developmentally appropriate sex education. We are not showing 5-year-olds porn. That's not a thing. But we are teaching them of like, this is your vagina, this is your penis. Some people have these parts, some people have these parts. Because if you're teaching nose, ear, mouth to your child, teaching them breasts, vagina, penis, anus is no different. You're just using medical terms. The reason I also like when parents teach their children certain terms and the ideas of consent very early on is if, let's say, for example, you're not using the anatomical term, you're saying dingling, like just what you're calling your son's penis is a dingling at this point. Well, if someone's going to engage in predatory behavior, they may call it a willy. And a 4 and a 5-year-old is not going to go, that's my dingling and my willy. They're the same thing. So if something does happen to it, then they can report it to the parent. But they may not know of like, oh, this person's an adult and they're doing this. They're touching me there. Why is that bad? Especially if a predator is using those patterns of like, this is our secret touch time, or this is just for us. Don't tell your parents, especially if they're younger. When they're a little bit older, you may see patterns of more threatening, and that really is a big deterrent for children to report because they're trying to protect their parents. So the more we do developmentally appropriate sex education about terms, about consent, teaching children that you are in control of your own body, about who touches you, really being able to explain things of like, you don't have to hug anyone you don't want to. It not only increases the child's autonomy within their own body, actually sets a wonderful foundation for reporting of if something does happen, your child is more likely to tell you that it happened. Because a lot of individuals who've been sexually assaulted as children, they don't tell their parent. They
I
just
think
don't.
it's really hard for our generation to get in the mindset of giving our children full autonomy when that's not the way we were raised. And I don't know about you guys, but I have grandparents who just kind of like take the lovin's and take the sugar without asking, because that's normal for our family, you know, like you just hug whether you like it or not, you give kisses, you sit on grandpa's lap whether you gave consent or whatever. That's just normal. That's how you show affection. So now it's hard in our generation to not offend family members, but to also advocate for our child that, you know, he's not really feeling like giving a hug today. Can we do a high five instead? But it is really important. And if we want to try to get numbers down and be raising kids that aren't keeping secrets, like we don't do secrets in my house. We can do a surprise, like let's do a surprise for dad, but we don't do secrets. So kind of setting the precedence for future generations, if we want to try to get numbers down for sexual assault on children and stuff like that, we really have to be making changes now.
What about teens that are sexually assaulted and then they have that feeling of shame for even bringing it up, telling anybody? What are recommendations that you would give for maybe older children?
And it's a great idea to set the foundation very young, but if maybe you haven't had the opportunity, really being able to identify that. Again, I'll perseverate forever on it. Like, sexual assault is not sex, and it's also not normal. And I hate to use the word normal, but I'm going to in that context. The idea, like, this is something that should not happen, so it's not normal, but it's so common. If we could change anything, I'd love to take that out of our, world, if we could remove that. But with teenagers, it's also a little bit of a complication too, because it's not uncommon that due to the physiological changes during adolescence that an individual may experience arousal or orgasm during a sexual assault, and that's so confusing. So being able to really explain things to children and adolescents of your body sometimes does weird things. That doesn't mean you like it. I use the analogy of like if you really have to fart, and this usually works when you're explaining this to teenagers and children, and honestly some adults too, is like, do you ever just like occasionally like you just feel the tummy grumbles and all of a sudden you just go, and they're like, yeah, that's really normal. I'm like, yeah, that's just your body's natural reaction to some gas in your tummy. That's all that is. Equating that to sometimes your body is just going to do very weird things. Sometimes you feel those little tingles right there, even in a scary situation. That sets the foundation for them to feel like that's common and that's not something to be shamed. We set the idea that kind of what shame is connected to is this idea of wrongness or badness. So that's why we normalize. The whole emphasis on normalization is to decrease shame. more we talk about the shit, the less we shame the shit. So setting the foundation for developmentally appropriate sex education within teenagers is going, hey, this is normal. Your kids are probably going to masturbate. Your teenagers are going to masturbate. They're going to want to have sex with partners. They're sometimes going to not want to have sex with partners. So setting a good foundation of, hey, it's normal, whatever's going on. It feels really scary. It feels really weird. Do you feel safe? And really emphasizing safe sex, both with yourself, with others, as well as looking at this is what sex is and this is what sexual assault is, and talking about coercive relationships, talking about toxic dating. This is where I love to just really highlight in media really bad examples of dating and like terrible like toxic relationships. Like Harley and Joker are my favorite couple to like really dissect and be like, they are so bad. They are so toxic with each other. Can we get less of them and more like Morticia and Gomez, please? And like using examples that their adolescent brains are gonna reflect on. So like being familiar with what your kids are watching, video games, but not be like, oh, be careful what they're watching. No, play an interest of like, what are good examples of healthy sexual relationships or healthy couples relationships, different body types, and then emphasize those and not shame of like, don't do this. The don't do this to a teenager is the fuck I am. Mm-hmm. If you're like, no, please go ahead and do this. Just please do it safely.
Mm-hmm. Yeah, we kind of talked about that with the addiction, like having drugs and alcohol talks with your kids is kind of the same as sex. Like if you're going to do it and we're all human, we know you're going to do it, please do it safely. Use your brain about it. We know how important the sex talk is to jurors, but how important is a masturbation talk?
I personally think it's very important. I got the masturbation talk at 14, and I will never forget it. And I was like, you are a few years too late for that, Mama, but I appreciate that.
Pay for effort.
Yeah. Nice try.
I was like, okay, then I already know those things. I think the masturbation talk is really helpful because it really emphasizes, again, consent, body autonomy. It also gets some of the quote-unquote nerves out. So having the masturbation talk with your children is not about teaching them to masturbate. That's not your role. Let them figure that stuff out themselves. It's setting the foundation for, hey, touching your body is normal. Not to mention, most creatures, most humans are going to start masturbating in utero. That's pretty much just normal. The children are going to, anyone has little children, they have their hands in their pants constantly, regardless of their gender or their sex. That's just how it works. Because it's just a biological response to touch. They don't know it's sexualized. So the analogy I like to use is the Q-tip, which is you stick a Q-tip in your ear and you're like, oh, I got the spot right there. It feels really good.
Oh, I feel so good.
Oh, I love it. Even though we're like technically not quote unquote supposed to stick Q-tips in our ears.
Yeah.
But
Healthy,
I'm still
so
going
good.
I'm still going to. That's just how the nature is. It feels good. That's literally what your kids are doing. They're sticking their hands in their pants. They're touching their body parts because they're like, ooh, that feels nice. They don't know it's solo sex. As they get older, then you have hormones playing a huge role in it. We are seeing children hitting prepubescent and puberty very early compared to when we were growing up. And they're going to be starting to explore these things. So having the masturbation talk of, hey, this is really normal. This is very common. This is something that we do in private, just like we go number 1, number 2 in potty. We do that in private. We shower in private. You can do this in private too. Being able to look at, if you're involving someone else, that's probably something you want to have a conversation with them about. That's a good opening conversation about consent. So teaching them that it's really okay to touch their bodies, giving them the opportunity to feel comfortable doing them, saying, this is why I don't love the idea of parents who remove the doors from their children's bedrooms.
Lack of privacy.
Yeah, like I really don't love that idea of like teaching that that's their space. It's like, this is your space. You can do with what you want in those moments, and not to use the absence of privacy as punishment. It does not work within that. It's a great way to have your child learn a lesson that will be with them forever. That's probably not the most helpful thing.
Well, and they're going to find privacy somewhere. So if they're
Showers.
not doing it in their safe spot, then they're maybe not making the best choices other places.
Yeah.
I have a very dear friend that when he was in the Army, I was like, hey, buddy, because he was deployed. I think he was in Iraq at the time. I said, where do you masturbate? He's like, in the shower. It's very cold and it's very quick, but it gets its job done at that point. Because he's like, I don't want to do it in the barracks. And I was like, no, that makes sense at that point.
Yeah.
Of just being able to look at where the privacy is. So like children, once like teens and adolescents, like once they're old enough, like and they have shower time, there's a reason your teenage boy takes a very long shower. That's okay. Let him just pay a little extra in the water bill. It's okay.
And it's better for him to be exploring his own body and knowing what he likes or doesn't likes or what he's comfortable with and be exploring that now than with somebody who could possibly be a predator in that area.
Well, I think that's where also talking with your teen about if they have a partner or if they're starting to date, having that discussion about consent.
It's such a huge conversation, and I'm a big emphasis of there's a difference between consent and enthusiastic consent. Anything of okay, or, well, if you want to, that's not enthusiastic. So really using, again, examples that match what's going on in your child's or your teen's life and going, you know how you get super excited about Spider-Man? You know how you love Spider-Man? If your partner isn't like, Spider-Man, having that reaction, maybe they're not as into it. Maybe you can just do some other things. And that's where even having the example within sex education of different sexual practices is penis and vagina doesn't have to be the only type of sex. There are other things that can be done. How to have safe other types of sex. So having conversations about using condoms during oral sex or using the Laurel panties or dental dams during oral sex. Being able to explain that to children and adolescents is helpful. Again, developmentally appropriate. And this is where a lot of parents are like, how the fuck do I do this? How do I explain this? I'm like, you do not need to reinvent the wheel. Someone already did this for you, looking for evidence-based research, comprehensive sex education material. So you're not having to learn all of this on your own, but you can really give that to your teen and your child in a way that's going to match their level. Even just saying, hey, I know this is really scary and sometimes other people in your life are talking about these things, here are some condoms, and just giving them that material. Not being like, okay, I'm going to teach you how to use a condom. Here's a banana. The world is full of the internet. There are great ways to help explain things. One of my favorite resources for teens and adolescents is Scarlet Teen. They do such really, really great resources of sex education for adolescents and at developmentally appropriate levels. Washington State is currently the only state in the U.S. that has comprehensive sex education in the public school district beginning at age 5. And all of those resources are super, super public accessible. Please look at your resources, things that you don't really know about, because you know about your sexual life, you know about consent within your world, especially if you're partnered, you've been with the same person for a little bit. Your conversations with consent are very different than your teen's conversations. So using the resources to open up that conversation. That way you're not having to do it all by yourself and feel like you're drowning.
Well, and I imagine at 5 years old, they're not teaching these kindergartners about penetration and things like that. So at that basic innocent level, what are they teaching them?
So it's a great question. They're very much teaching them basic bio. They're teaching them basic biology. They're teaching them basic bodily autonomy and consent. They're really just emphasizing differences in bodies of some people have different bodies than you, or really looking at explaining to children consent with hugs or with other type of touch. Because if you use that as a great foundation for when they get older within sexual functioning, way better to help deter sexual assault, which is awesome if we possibly can. So developmentally appropriate sex education is really starting at the very basic level. And the illustrations that are done are very cartoon-based. Now, we're not talking hentai. That's not what we're talking when I say cartoon in this context. I literally mean children's books. I love what's happening to my body. There's some really, really fantastic sex education books that are specifically children's books that are explaining this to them. Because we are going to explain the birds and the bees and where do babies come from. You're explaining that in a way that a kiddo is going to acknowledge. Not to mention most of these kids are I don't fucking care. They don't. They want to go play. Mm-hmm. So you're really just setting a good foundation of this is just something that people do. And leaving it at that versus you must never do this. If you do this, you're going through something bad that's going to happen. Yeah, please don't do that. That's so shamey and so not helpful because then the kids are like, what's that? There's this really prevalent belief amongst certain groups that the more you talk about sex with children and adolescents, the more they'll want to have sex. No research supports that. If anything, the more you explain sex to children and adolescents, they're like, ew,
Yeah, gross
ew,
out.
I don't want this. It actually is a deterrent. And if you explain it to them, they are more likely to use protection. They are less likely to have teen pregnancy, lower rates of STDs. We know abstinence-only sex education actually increases the likelihoods of all three of those things, and we would prefer that not to happen.
Where do you stand on the argument that sex education should happen at home versus school?
I lean on the side of, are you competent to teach your children all of the things about sexual health and functioning?
And do it non-biased, so whatever kind of trauma you're dealing with can't get your...
Can't project that on your children.
Exactly.
Yeah.
And it's also, we're kind of, with parents too, especially parents of our generation, it's like we were raised by people who did not have the internet. Our generation and the generation under us, they've always known a time that had the internet. So that's already going to really change things. So the average age in which boys are going to be seeking out porn is age 10. So the porn that they're getting exposed to versus when our parents were growing up, which is the older, Playboy magazine or the JCPenney Sports edition, Sports Illustrated edition, swimwear edition. There it is. I'm like, oh, versus Sports Illustrated. It's very easy to get into some of the quote-unquote hardcore porn very early. So if we don't explain to children how to safely look for sex, what about safe sex and porn and looking at those things, or even explaining to kids, I'm a huge proponent of explaining this to children of like what you see in porn is not sex. That is acting. Those are sex workers. Those are very vital individuals in our world, and showing respect for them as well. So if you're someone who has a background in sex education, you are a sexuality educator, by all means, please teach your children these things. If any of the things we just said made your butthole pucker a little bit and your heart flutter, please let someone who is more well-trained than you do that. And that's when we do talk about training. Having some random person be like, I'm going to teach your kids about sex. Yeah, please don't. But if you have someone who's gone through like a sex certification, or someone who's gone through health administration training, who's gone through comprehensive sex education, that is someone I would much rather have teaching your child than I had my health teacher. I was in 8th grade. He was our science teacher, and he didn't know any science. I learned more science from Bill Nye. What I genuinely actually want, one of my life goals, is to take Miss Frizzle from the Magic School Bus and just have the Magic Sex Bus. And not in a kinky way, and literally just, we're going to talk about sex appropriately. I learned more science from Bill Nye and Miss Frizzle than I did in all 4 years of high school science. And I think a lot of kids, especially who have limited access in the public school district, or who maybe don't have as much access in their school structure, that's where you get to use developmentally appropriate sex education by trained individuals using evidence-based comprehensive sex education. If you as the parent cannot do that, please recognize that you don't have to do it. Also, it still means you can talk about sex and go, I actually don't know these things, because you're setting a very good model for your children to say, I don't know everything, let's learn together. If you don't remember how viruses work, please watch the Inside Ralphie episode of Magic School Bus with your child, because they have so many questions, and these kids are so fucking smart, but they're also fucking stupid. They're supposed to be. Children are what I like to call the drunk woo girls. So if anyone's ever been on the strip at 2 o'clock in the morning, I'm going to be very genderfied, but the drunk woo boys are there too, but the drunk woo girls are the ones that are most known from this episode of How I Met Your Mother, which I really like too. And you get these individuals who are very inebriated. They want to text their ex-boyfriend. They want to go get In and Out, but when you're trying to explain that In and Out's closed right now, we can't do it. That is literally how your child is supposed to think all the time. They're supposed to. They're developmentally like that. So you're using the brain as an adult, and that's really hard to turn off once it's on. Your kids don't think like you. Don't try to teach them sex ed as an adult. Teach like a child. How would a child learn about these things? How would they ask questions? Most of them don't think like we do. I would fucking hope not. They're supposed to be stupid. Let your kids be stupid and let yourself be anxious.
So I had kind of told you guys about how my son has a speech delay, and this child, I would try to do things like flashcards with him, and he was not about it. Wanted nothing to do with sitting down and like just being boring, looking through a book and learning numbers. He's also hugely fascinated by monster trucks. And so we found this YouTube channel that puts numbers on monster trucks. And now my 2-year-old counts to 20 because it was his
Yay!
interest. So that Miss Frizzle thing's a great idea where you're meeting them on their playing field. And if you have like single parents or, you know, mom or dad passed or whatever, like I would not even know where to begin to teach my boys about what it feels like to have sex as a man. So that's not my area of expertise. It would be nice to have more resources like that my boys would be able to kind of familiarize with or relate to. That it's an area that I am completely inadequate in.
Well, especially also you have neuroatypical children too, so neurodivergent children, so individuals who have autism or neurological delays. That adds an extra layer on top of it. And we see individuals who are neurodivergent actually have a higher rate of being the victims of sexual violence. So even more so, like they're a very vulnerable population. Being able to developmentally appropriate, explain that to your child who is more neurodivergent is so vital to their freaking safety. It is such a huge area because they don't think or don't communicate or think the way that we do. So you got to really match it to them. So match the content to the child's interest level as well as their developmental level and their neurocognitive functioning. It will do them wonders in the long term.
Did you have any other questions that you wrote down?
I'm curious about what you said about cultures and some cultures being very against sex, and what are those cultures, and then how do you continue to work with people like that and bring maybe awareness and acceptance and maybe to children that belong to those cultures of, okay, let's heal from this and move on from it, and this is how we can enjoy sex without just thinking about procreation. So sorry, that was a big question.
Oh, I love it because it's one of those things, and this is where some of my biases come out, is like when we talk about certain cultures, you're also looking at the interconnectability between culture and religion. So in certain religious, typically conservative religious environments, like you're going to see a lot more anti-sex, you're going to see a lot more shame, you're going to see a lot more like specific traditional gender roles. I speak a little bit more with adults because my background is not in kiddo work, but I've worked with individuals who have survived those environments, and just the amount of basic sex ed that they do not know. Like when we talk about sex education, it shouldn't be limited just to children, it should be adults. So adult sex ed looks very different than child sex ed. In working with adults who have survived the church or who've survived religious trauma, it's really being able to normalize that they did not know these things without shaming them of like, you don't know this. And being, if they're still in the church or still in that part of that cultural variable, kind of going, hey, I recognize this is a thing. Would you like to know more about this topic? Asking adults consent is something we should always do. And like even with asking hugs of like, can I hug you as an adult is a good thing too. So we're teaching consent not just to children, but to adults as well. With sex education, if someone is still in a conservative culture or a conservative religion, being able to ask of like, are you interested in learning a little bit more about this? And really not to shame them, even if you have those biases connected to it, where holy crap, this thing is so inaccurate, my brain wants to explode going, but this person actually believes this. In what way is that negatively impacting them, and asking consent if they'd like to change some of those viewpoints as well.
In my personal experience with religion, they highly encourage the woman to be obedient to their husband and be a servant in their marriage. Is it common to have marital rape in marriages where women don't feel like they can talk about it because it goes against being obedient or what they're taught?
It's very much so. It's that cultural variable of this is a woman's job. So like individuals who are part of those cultures and those religious environments, to them that's normal. Again, when we talk about normality is subjective. To them that is normal. So being able to assess, are they bothered by those experiences? In what way is that negatively impacting their individual functioning? And for us as providers and even as people going, I wholeheartedly disagree with that. I'm like, yeah, and is the person experiencing distress as a result of that? Even though it is objectively marital rape because the person does not want it, is it still happening? Yes. What is the person's individualized response to that situation that's going on? But it is very common, unfortunately.
Shoot, I just had a question. Is there a possibility of having a healthy sexual relationship within a marriage post-marital rape?
I've seen it. I've worked with a couple individuals, yes. It's looking at how willing are they to engage in change? How willing are they to have conversations about what happened? For some individuals where that is part of the culture and being able to identify, is it still happening? That's another factor, because if it's still happening, the answer is probably going to be no. But if it has ceased, looking at how do you rebuild, it's somewhat similar to like intimacy after infidelity, and like when there has been a major breach in trust and safety, it's rebuilding that. So yes, it can happen. That's not quite my area of specialization, because that's a little bit of where my own biases come out, and I'm just like, yeah. So that is where I'm always very aware of where my own difficulties come into play.
Is there a gray area in marital rape versus like a sexual assault that happens at like a frat party or something? If you date rape somebody, you know that that's wrong, right? Or like there's right and wrong, black and white.
The perpetrators may not view it like that.
Yeah, if they've been traumatized or sexually assaulted as a child in their own history, they may not understand getting consent with their wife or their husband. So there's a little bit of like a gray area, I guess.
I imagine like also at a frat party, taking substances and adding that into like, is this person taking substances, and then in their own mind they paint their narrative of, oh, she wanted it, oh, she consented to it, even though that may not be the reality of it.
Yeah.
And so again, that's
they're not in a headspace to be able to give consent.
right.
Well, we're also, and this raises a question too, which we see a lot on like college campuses, is if the person who is engaging in the sexual violence is also intoxicated, a lot of people will say, well, that's an excuse for behavior. Well, when both of y'all are intoxicated, neither one of you can actually give consent,
Right.
technically. So that's when we talk about like gender variance, the idea of, let's say we're going to be heteronormative for a second. Let's say it's a male who is intoxicated and a female who's intoxicated. Neither one of them can actually give consent. So then what if they have sex? Is that non-consensual sex, or is that drunk sex? Is that sexual assault for both of them? They're both the perpetrator now? This is where things get so complicated. Most people's brains go, because it really is a big issue. So like a lot of work that happens on college campuses, because of the like developmentally appropriate in their, in your 20s, the idea of, well, what role does substances play in that? This is where you get into culture, because how many TV commercials do we have, especially during Super Bowl time? They're all alcohol related. What are the messages about alcohol use in our culture, and about drunk sex, or how anxious we are in general? But sex is a social lubricant. Or what is it, like, not necessarily, or like the idea of like beer goggles and all of those really unhelpful patterns. To say that we're ever going to be able to undo all of those patterns is unrealistic. Can we at least make some of those changes and start having those conversations of how do we keep ourselves as safe as possible in a world that has its inherent risk connected to it? It's a little bit like driving. You drive a car every day. Well, at least most of us do. We drive a car every day. We keep car insurance. We wear our seatbelts. We don't drive intoxicated. Does that mean we will not ever get into a car accident? No. Are we just trying to deter it or decrease the likelihood? Yes, absolutely. That's all we're doing. It's always on the table. We're trying to mitigate risk, which is what happens a lot with like substance use. The idea of how do we risk, I forget the terminology, but like reduce risk use, or like the idea of like reducing risk.
So what would
Harm
you
reduction. Harm reduction. Yeah. Risk reduction. Thank you.
What would you do to change the likelihood of sexual abuse at college level? So we talked about elementary age, using things like Miss Frizzle. That can go into maybe preteens. Teens think they're cooler than us. Doesn't really matter what we do. That conversation is going to be awkward either way. What do we do for college age?
And this is where the college campuses, the work with like the counseling and psychological services do a really great job. A lot of more awareness about it. The colleges have done really quite good about it. Is looking at what are your resources. I still think that it should be something that is more talked about in our general culture, because unlike the secondary school, like when they're in elementary school or high school, you're with those kids every single day. Like you have the opportunity to give them increased information. In college, you don't have that access, especially here in Las Vegas. UNLV is relatively a commuter school, so we're not on campus that often. It's looking at getting them that information given to them in other areas. And this is where I think social media has really come in to try to fill that void. Some of it's very good. A lot of it is very terrible. Very terrible. So like even again, if you have a college age kiddo, I still call them kiddos. Anyone that's younger than me at this point is a kiddo. But if you have a college age student and looking at, hey, what's your relationship status? Or like looking at dating, looking at alternative lifestyle, and looking how to do things safely. Again, just provision of resources really, really helpful. Looking at what information is currently on the college campus. You want to be very active in your child's life when they're away in college, looking at what the college campus or college counseling center has, looking at the student wellness center. I love our student wellness center that we have at UNLV because they have condoms right in the waiting room. I love it so much. Like, they talk a lot about that. They have dental dams. They got examples. Like, it's just putting that level of accessibility in their eye shows and sends the message, hey, this is okay to talk about. Hey, this is normal, and it's really decreasing it. So on college campuses specifically, because it's considered like, quote unquote, like a protected population, because we can't externally go on college campuses, please do not do that if you can. You're looking at what resources is the university itself doing. So usually the Student Wellness Center, the Psychological Services Center are the ones that are really spearheading that. So getting actively involved in volunteering there if you possibly can, or really just even like if you have excess, like if there is some flexibility with finances or time, please donate your time and your money to that if you have any potential as well. And that's where, like, during Pride, this is a lot of within the Pride, like LGBTQ plus community, a lot of the Pride events have sexual wellness centers. That's a great way to give back and like volunteer there, putting your energy within those groups that are locally working with your college age students.
And what other ways can we make talking about sex less taboo?
So many ways. Really, I like being able to highlight accurate information in media and then highlighting inaccurate information. Like, one of my biggest things, I swear this has a point to it, one of my biggest pet peeves is when we see people in like media taking those like historically genderfied ads, and they're like, the woman is the subservient and the man is the authority, and what they do is they switch the genders and they're like, this is normal. I'm like, no, you just made it worse again. Like, now we just switched it. But a lot of people really have that frustration with it. So really being able to say, we don't want to shame, we want to look at change, but what does the change actually mean? What are we trying to do? So looking at what is gender equality? What is sexual equality? We talk a lot about the orgasm gap in male and female sexual functioning, instead of being like, let's keep perseverating or repeating why women don't have, or that the fact that women don't have orgasms at a higher rate, and go, I wonder what we can do, what's going on with that. Does your male partner know that you don't orgasm? Bringing it to their awareness, I think, is really, really helpful when looking at partners, and looking at, if you feel uncomfortable and don't know how to have this conversation with your partner, they probably don't either. So you're both floundering, and looking at the role of anxiety. And that's why having really good resources like Sex Without Stress by Jessa Zimmerman is really fantastic. Come As You Are by Emily Nagowski. She Comes First by Ian Kerner. Please look at these references. Again, someone already invented this wheel. Please don't have to reinvent the thing. Just put new rims on it.
What exactly is the orgasm gap?
The orgasm gap is a piece of what we're seeing is that individuals who have penises experience orgasm at a higher rate than individuals who have vaginas, at a statistically significant difference. So looking at individuals with penises are going to orgasm a certain percentage more than individuals with vaginas. So looking at that there is an orgasm gap in between the sexes.
Is that because they're not wanting to put the time in?
Yes and
Could
no.
be a lack of education.
It's that. It's also you are in charge of your own orgasm. So really decreasing this belief structure that it's your partner's job to give you an orgasm. It is your job to make you come. And that sex is more than just
I think I'm
orgasm.
gonna put that on a shirt.
I have
Can we
so
make
many
that a hashtag?
So many phrases.
Let's do it.
We'll title the episode that. It's your job to make you come.
It is
Yeah.
literally your responsibility. And looking at the factors that decrease that, whether that's shame, whether that is sexual assault history. It's not uncommon that people who've had a sexual assault history have intrusions during sexual activity, including solo sex. I use the term solo sex synonymous with masturbation. They're kind of the same thing to me. It's the idea of what gets in your own way, what makes your body feel sexy, what makes you feel eroticism. I love the idea of eroticism, not sexiness, because sex is often like sex sells and that idea, but what is sexy without being overtly sex? And giving your brain that opportunity to go, what's turning me on? Like if you're sitting there watching a show, like if you're watching Last of Us right now, and Pedro Pascal is on the show and you're like, hey, he ain't naked. And I've only seen a few episodes. I've watched the game. I get constant updates from my mother.
need to catch up.
Constant updates from my mother about this. If you're watching him, he's not overtly sexual, but holy damn, is he sexy. Why is he sexy? What's the eroticism? A lot of people, it's that caregiving. Like, that's why everyone
He's
was
a dad figure.
He's very
That
much
does
that
it for me.
But he's protective. It's not necessarily the dad thing. He's also got that in the Mandalorian. Like, he's a protector, but he's very honorable within that too. So looking at why are you attracted to certain things in media, what makes it attractive, what are some of the things in media that you're like, ugh, without shaming, because there's certain things you're like, it's not for me at that point. That's okay. But what makes your brain go, well, I could get down with that. Not just, I want to fuck it, but more like, my brain is now thinking. There's a difference between being attracted to something or someone and finding it attractive. I use the joke very, very much so of like, I think there's two types of people in the world, those who like Thor and those who like Loki. Where on the one hand, you got people who are like, damn, that Thor, he's so strong, he's so muscly, and I love that blonde. Then you got people who are like, oh my God, please give me that like sultry, tight, like gothic looking body. I feel like there's two people of that. I lean on the like, I think Chris Hemsworth is a very attractive man. I think he's very funny. I don't want to fuck him. I don't find him I'm not attracted to him. But give me Tom Hiddleston all day, like every single day.
I think that's why it's also important to talk to teenagers about masturbation, is that my mom always said, how is a man supposed to know what you want if you don't know what you want? So like you said, it's your job to make yourself come. That's a lot of orgasm, I think, is headspace. So if you can't clearly communicate to your partner what it is that you want, what it is that kind of gets you there, he's not a mind reader. He can't get to that conclusion on his own.
He also doesn't have a vagina.
Yeah.
Like, he doesn't know. We don't know. I don't know what to do with a penis unless my partner is like, hey, a little faster, a little bit tighter. Like, thank you. I don't have a penis. I don't know what I'm doing.
And also changing the way that we communicate with them. If I say don't stop, that doesn't mean increase the speed.
I mean, same thing.
That means
Stay the
thing.
same.
We're coasting. Just get us there. You don't have to do anything extra. But like you were talking about it being more of a mental thing, like getting in your own way, I think is a big problem sometimes. It may not just be physical touch. If you've got anxieties about what happened today, if something else is playing a role in your brain, that's also going to be hard.
There's a huge difference, and this is in sexuality research. There's a huge difference between desire and arousal. Arousal is just physio. How is your body? How is your genitals feeling? Is there blood flow to your clitoris? Is there blood flow to your penis? Are you lubricated? It's basic bio. So that's when we talk about biology with kiddos. You're just talking about arousal. Is there blood flow? Is there some stimulation that's happening there? Versus desire, which is your biggest sex organ, which is your brain. Dr. Ruth has a fantastic quote which says that the most important 6 inches are the ones between your ears. And I love her so much for that reason, because desire is your brain getting involved. And your brain is one of the most powerful components within sexual functioning, because we want your brain to get turned on too. How focused are you on those physical sensations? Are you thinking about whether or not you have a PTA meeting this week or next week while your partner was eating you out? Like, you're not going to come no matter how well his tongue is going. Now, occasionally may it happen? Yes, because with arousal, occasionally if you get the quote-unquote right stimulation or consistent stimulation, even if your brain is not turned on, your body is going to respond. That's just the nature of how it works. It's biologically responsive. Versus, is your brain turned on? If your brain is distracted with intrusive thoughts about what you have to do in the future, or intrusive thoughts about historical negative events, or even just being like, all I want to do is take a nap right now. I am so tired. I love you, my partner, but I'm so sleepy. You're decreasing the likelihood that you're going to have an orgasm at that point, because you're not actually in the moment. Lori Brotto has a fantastic book that I highly recommend called Better Sex Through Mindfulness. And it really talks about being in the moment, focusing on your body, being in the here and now actually increases the likelihood that you're going to have an orgasm, no matter how good the toy or how bad the toy is in that moment.
What's your advice to patients who need help getting in a good headspace before sex?
Make sure the children are asleep and the dogs and cats are out of the fucking room. Nothing kills the mood more than a dog sitting there looking at you or trying to lick your partner's balls. Like, please don't. So please make sure try to reduce the external stressors as much as possible, because you have a lot more control of it. You really have limited control over historical experiences, because they're gone. You want to be able to look at redirecting your brain when those historical memories may pop up. But if we can decrease some of the external stimuli, please do so. And please, please help on that. So really just honing in on your body, what's it doing, what's going to make, again, you feel sexy. Do you would like to shower first? Is it you would like to have it scheduled so you feel less anxious knowing whether it's coming or not? Pardon the pun. So being able to really look at decreasing some of those external factors so that you can focus on the internal factors, especially internal factors that you don't have control over, which is just random intrusions, which you will have random intrusions and intrusive thoughts for the rest of your life so long as your frontal cortex is still moving. This is why some people are like, I'd love to be a zombie because then my brain won't think. And I'm like, yes, you're still going to think, it's going to be brains. Like, you're still thinking, you're just thinking about something else.
Why don't we wrap this episode up with a couple different things? So first, give our listeners some therapy homework. Maybe some homework you might give to somebody who has a hard time getting in the right headspace. How can they kind of amp up their confidence, or I don't know.
I like to phrase it like integrate sex into your life without having sex.
Okay, yeah.
Oh,
there we go.
yeah.
This
So-
is where
Good one.
you're going to love this homework, because this actually does very much involve media. So when you're sitting there, you're watching Last of Us, you're sitting there watching all these shows, pay attention to what is making your brain go, hello there. Why? So if you're watching Pedro, most people are very into him right now. If you're watching him, why do you like him? Write down all the reasons that you like him. If you're sitting there and you're thinking about your partner, write down the reasons that make your brain get turned on. Let your brain think about that. If you're thinking about your own body and you start shitting on it and you're like, oh, this looks like this, looks like this. What are all the things that you appreciate about your body? The fact that it made a bowel movement today is a very important thing. That's really well done, everybody. How's your sleep doing? Really honing in on those basic biofunctions and paying more attention to what the stimuli around you actually is versus just existing in relation to it. So if you are watching things on TV or you're watching movies or different things on social media and you're noticing your brain being attracted to something, identify what is attracted. Why are you attracted to it? What is attractive about that item? And this doesn't have to do anything to do with your sexual preferences or anything. If you identify as a heterosexual female, you can appreciate other women in media being like, why do you like that? What about that? Is it the style? Is it the cut of the clothing? Is it the way that they did their hair? What is it that's attractive? Because it's really just giving your brain that space to evaluate what's going on versus just, I'm horny. No, your brain can be horny. Let's make it horny versus your genitals.
What are 3 things that you do to preserve your mental health?
For me, one of the first and foremost things, I have a little pug. I love my little buddy. His name is Puglo Wren. So just watching him be so excited to eat chicken is just the most amazing thing in the whole wide world, and just the snoring. So playing with him is a really important factor for me. I do quite a lot of cosplay, so that I love art. I'm a terrible, artist in certain ways, but I can paint things. I love painting and sewing, just making things pretty and makeup and things. It just is a great, really focused thing. And then one of the things I think is also really helpful for me is I spend a lot of time with my partner, and he's wonderful. And I'm just going to say, sexual functioning is important to me in my life. So spending time with him, getting frisky, but not always having sex, if that makes sense. So really spending time with touch, being able to turn the brain on. So those are kind of my 3 things. And anytime I'm in a conference for psychology, people are like, what are your self-care techniques? I said, orgasm. Because life is better the closer you are to your most recent orgasm.
Can you go in a little bit more on that, what you do to feel intimate and have sex without the actual act of sex?
With him, one of the things that we do quite a lot is we dedicate really specific time with one another. And this isn't like date days. We do date days, but it's also we spend time we always have dinner together and we're sitting and talking. We touch each other a lot, and not in a sexual way. Like, yes, there's plenty of that, but he always holds my hand. He's touching me. I'm touching him. Touch is really important to me, but not necessarily sexualized touch. That does happen a little bit, but we're always pretty much constantly touching and aware of one another. And I think that's something that keeps us very connected. It's also something that I was raised with. My parents have been they're married for 40 years. They've been together for 50 or so, off and on over those years. So always seeing touch and like being really aware. And that is very consistent with the research of it's not actually sexual touch that leads to longevity in relationships. It's just physical touch.
Do your parents attribute their long relationship to physical touch?
Mm-hmm. Especially so, like it's physical touch and quality time spent with one another, but not necessarily sexual. I keep trying to get them to bang more, and I'm like, here's some more lube, here's some more things, and they're like, I'm old, I don't care about that. But they always touch, they always spend time together, and that was something I was very much raised in a household. My father used to race cars, and my mom and I, we used to pit for him. And we had a routine of every time right before we'd strap him into the car, my mom would have a conversation with him. She would kiss him and put the helmet on because you never know if he's going to die each lap. So it was something that was always very important to us, is spending time with our like they always spent time with one another, but they always kissed, they always touched, especially in a non-sexual way. I knew stories of their sexual escapades, but as they've gotten older, that I've never seen the touch dwindle ever. Not in all the years that I've been around.
Nice.
Beautiful.
I like that. Yeah. That's a great secret for a long marriage. I like that a lot. Okay, guys, we're going to wrap up this episode. Check us out on Insta. It's at Nora's Table Podcast. Same with Facebook and YouTube. And special shout out to Ignis Umbra Studio, where we are recording today with Dr. Jordan Soper.
Yes, and feel free to follow me on as much as difficult as it is, I have Instagram, Twitter now. I don't tweet very much because I just can't figure it out. But I do a lot of work on TikTok really about sex education and trying to make it funny as much as possible, not making a joke out of sex, but just sometimes it's very funny. Flavored lubes, not recommended.
Is your TikTok handle just your name?
Mm-hmm. Dr. Jordan Soper. I try to make everything very consistent because otherwise my brain will explode.
Yeah, that's Soper, Soper. Go check her out, and we will catch you guys next time.